What role does social isolation play in health outcomes? This is a question we tackled on the Functional Forum.
Those people who know me probably know that my most exciting part, and the reason actually why we ended up doing this session here, was because of the support group. That is truly incredible, and I'm just so excited to hear about it and hear the progress of it. And our goal with these Functional Forum meetup groups is to develop these communities. You've heard me use this phrase before all the way through, that community is the guru of the future. And this has been high on my mind recently. In 2015, we did a Functional Forum. It was August 2015. It was from the Institute for Functional Medicine's annual conference on genomics. And I was convinced that community had a really strong role to play in solving these problems in medicine, but I really didn't know how big an issue it was. And then I heard UCLA Stress Lab researcher Dr. George Slavich, and he said this.
It's a very interesting meta-analytic review of a bunch of different studies published in PLOS Medicine in 2010. They just looked at the odds ratio of all-cause chronic disease-related mortality as a function of these traditional risk factors and, in addition, high levels of social stress. Social stress compared to these traditional risk factors was a stronger predictor of chronic disease-related mortality than physical inactivity, excessive alcohol use, smoking, and a bunch of other things that I'm not showing here. Now, social environmental patterning of mortality risk is not totally new. That's not a new concept. 20 years ago, House and colleagues published a really interesting and landmark paper in Science showing that across multiple countries and cultures, mortality risk decreases as social integration increases. And this is cross-cultural, this is internationally. As best we can tell, social integration is really important for health. Social isolation and other types of social stress are really bad for health, especially for health that involves immune system activity.
So here's a researcher at the UCLA Stress Lab actually showing not only the facts that you saw there, but the mechanism. And it really got me thinking, it got me excited, because this is something, I think to a certain degree, we're all a little bit bored of talking about food, even though it's super important. And I think that this is an area where there's a lot of excitement. And over the last week, I've had an opportunity to do my first CME, Certified Medical Education talk for doctors, which is quite amusing / interesting when you realize that I have no medical credentials at all, right? So to give a medical talk where people can actually get credit for attending seems a little bit unlikely. But if there's one thing that we have done at the Functional Forum, it's created community. And both of the talks that I've given at the Integrated Health Symposium and at UCSF on Saturday, I can see that there's a twinkle in the eye of providers who are excited about this because they know it and they've seen it. And so I've got a big announcement today, is that 2 weeks tonight, we are going to do a special webinar for our Functional Forum community called Social Isolation, How Integrative Clinics Are Solving America's Biggest Root Cause of Disease. And just to give you a little bit of a taster, are the biggest players in medicine, is a hospital capable of solving this problem? Probably not. Is pharma capable of solving this problem? Probably not. But what is really exciting is the most innovative, integrative clinics out there are building structures in their practices that can help to solve this problem, introducing people who want to be healthy to each other. That's the reason why I'm here tonight, because when I heard about the 3,500 people in the support group, I was like, this is the future of medicine. It's free, it's scalable. If we're talking about value-based care, nothing is more valuable than something that costs nothing, because value is outcomes divided by cost. And if you have 0 at the bottom, it's a pretty big number on the top. So check this out. Make sure to register. GoEvoMed.com/isolation. This is something that every health professional will want to watch. If you register for it, make sure to share it with your fellow professionals. It's going to be a game changer.
Hello, my name's James Maskell. I'm the founder of the Evolution of Medicine, and today we're here to talk about the 5 steps to becoming a leader in your local natural health community.
So we've created this awesome diagram so that you can follow along to see the 5 ways that you need to do. But the first and most important is your clinical practice. You have to do great medicine. And that's what we've encouraged, and that's why it's in the middle of this concentric circle diagram. The first thing you have to get right is your practice and your clinical practice. And there are plenty of education tools, there's plenty of content on the Functional Forum to show you how you can do that. The second thing is you can't have any impact without the right clinical and practical team around you in your practice. You really need to have great front desk people, great other clinicians in your practice that can help you to deliver this great medicine, this great blueprint to your community. So that's the second phase. The third thing you need to do to become a leader in your community is to develop a really strong relationship and network of your peers. And that's why we started the Functional Forum meetup, to be able to get together monthly with a group of professionals in your area and develop that sense of community. You can get referrals of people that you might refer out to, and also people that would refer to you. So we've made it really easy to do that, and we have a structure to make, to be able to engage that community. The fourth thing, and this is the outer ring here, is to actually engage with those groups in your community that are already invested in this process. Think of anyone who goes to CrossFit or anyone who's really into paleo. Those people understand food as medicine. They understand inflammation. They're not going to go to a regular primary care doctor. They need to be going to your practice. And that's why you need to take steps to engage the local healthy restaurants, the health food store, the CrossFit, the paleo communities, all of these groups where you should be the center of that community. And we've got some starting points for you to be able to do that. And then the fifth and potentially most interesting part is local businesses. Business holds the key in how functional medicine can proliferate. In America, we have to learn to adapt to our environment. And one of the things that is different in America than almost any other medical system is that companies control medical costs and have a benefit, a real frontline, bottom line benefit in saving healthcare costs. And your services could be super valuable to those businesses. But you have to have all of the other 4 pieces in place before you can go to businesses and provide a legitimate service to them. Now, if you like these ideas, but you find it a little bit overwhelming, I've got a special gift just for you, and that's a session with one of our Evolution of Medicine concierges. They're highly trained in helping to identify the best opportunities and solutions for your individual practice. So to book a time with one of the Evolution of Medicine concierges, please click on the link below. Thanks so much for your time today, and we'll see you next time.